Hello, my name is Kim Nguyen, and I am a undergraduate public health student concentrating in population data science at San Jose State University. And today I will be talking about the coping strategies utilized by young adults during COVID-19. My research question was, how are young adults coping with the COVID-19 pandemic? I wanted to determine the distribution of strategies utilized by young adults to cope with the pandemic and evaluate the association of various coping styles with mental health outcomes among this population. The COVID-19 pandemic has negatively impacted the mental well-being of young adults. On top of fulfilling school, work, and family obligations, traditional coping strategies that young adults may have employed before the pandemic have been challenged by shelter-in-place protocols. Young adults are already a vulnerable population to poor mental health outcomes, and this pandemic has brought an increase to the prevalence of loneliness, isolation, depression, stress, and anxiety. This increase highlights the need for effective health interventions. With a team of undergraduate students, we designed and implemented a cross-sectional survey representative of the young adult social networks of San Jose State University students. We assessed demographics, vaccine hesitancy, mental health outcomes, and coping strategies, employing a combination of standard scales and student-developed questions. For my research question, I only looked at mental health outcomes and coping strategies. I also restricted the age to 18 to 25. The most commonly reported coping strategies were watching shows, listening to music, or playing video games at 81%, sleeping at 71%, taking breaks at 64%, connecting with friends at 62%, and connecting with family at 58%. Connecting with family was associated with a lower risk of depression, suicidal ideation, and feeling lonely nearly every day. Similarly, connecting with friends is associated with a lower risk of suicidal ideation and feeling lonely nearly every day. Taking breaks, mindfulness practice, and exercising were also associated with a lower risk of poor mental well-being. Consistent with the literature on social support and social connections, young adults in the context of the COVID-19 pandemic who reported connecting with friends and family were less likely to report poor mental health outcomes. How can San Jose State University encourage positive coping strategies within its community? As a campus, we need to develop programming to enhance social connectedness and the usage of healthy coping strategies to address the poor mental health outcomes that young adults are facing during this pandemic. This can be done by partnering and supporting student-led organizations who understand firsthand the needs of this vulnerable population. As we transition to hybrid learning this fall, the campus needs to better advertise its resources and increase access to those services for students who are unable to return to campus. The institution can also utilize social connectedness to encourage community conversations about mental health and to reduce stigma in the student population. Through these efforts, we may in turn be able to support the mental well-being of young adults. I'd like to acknowledge the following authors and research team: the Fall 2020 Epidemiology class for collecting this data, and the Thoracic Foundation for their generous support. Thank you for listening.